Thank you all so much for joining our first Women on Wednesdays on web. We're all adjusting to this new sort of dystopian reality that we're living in. For folks who don't know, Women on Wednesdays was started last year as an effort to, bring advocates to the Capitol to engage with lawmakers on the policy proposals during the legislative session. We still plan to hold our Women on Wednesdays bi-monthly. So we'll be doing this every other week, but we will be doing them online for the time being. And we are shifting a little bit our focus because of what is currently happening in terms of legislation, which is state legislation, which is not much at the moment. I am recording this webinar, so it will be made available. I'll send a link out to folks so that, if you have to jump off or if you miss something, we could get back to it. But I think for right now, I think we should go ahead and jump in. Can everybody see the slides on the screen? If you're on a screen?
Yes, we can see them.
Great, thank you. Okay. So today, I think what we really want to focus on is just sort of an update on what's happening with the 2020 legislative session. We're going to talk a little bit about some of the 2020 policy proposals that are pending. This Women on Wednesdays is going to really highlight economic security. So there are a lot of other policy proposals that we'll be talking about in future discussions. But right now we are going to focus this one on economic security for families, because I think we can all agree that that is the most pressing issue right now. And then we will have a little bit of a call to action and talk about, the way that we here in Louisiana can be engaging on federal policy response to the coronavirus. So as many of you know, we're Lift Louisiana. We are a reproductive rights organization who educates, advocates, and litigates for policy changes that are needed to improve the health and well-being of women in Louisiana, their families, and their communities. I apologize for the sirens in the background. We have been doing advocacy around women policies that impact women and families since 2016. And as I mentioned, Women on Wednesdays was started to be a bi-weekly advocacy campaign to advance policies for women in Louisiana. We had a pretty successful pilot of this program last year, where we, over the course of the session, brought 50 advocates to the Capitol to learn about the legislative process, to learn about the different issues that were being debated in the legislature, and to engage their lawmakers directly on these issues. And so, these kinds of advocacy opportunities really provide what folks need to keep fighting, and they can really show our state lawmakers how important these issues are to the public. So I'm sure most of you also know that the session has been suspended until at least March 31st. And, we commend the body for taking this proactive step to protect public health, as well as ensuring that when legislation is being considered, that all people in Louisiana can safely interact with their representatives. We invited State Representative Mandy Landry to join us today on this webinar, just to give us a little bit of an update on that decision and what lawmakers are prioritizing during the suspension, and things that they are working on that we might need to know about and consider as we're sort of planning our next steps forward. So at this time, I'm going to mute myself and invite Representative Landry to unmute her phone and talk to us a little bit about what's going on.
Hey everyone, it's Mandy. Can you hear me?
Yes.
Okay. Hey.
Yes, we can hear you.
Hi. So like Michelle said, we suspended Monday afternoon, or adjourned. I'm not even sure what particular word was used. As of now, we're out until March 31st, but with schools and courts being closed till mid-April, I would say most of us think it's going to last a little bit longer than that. Big question, which we won't know as things change by the day, is when we get back, what's the focus going to be? I personally think we're just going to be trying to pass emergency legislation. I know there's already been talk of doubling unemployment assistance, addressing, food and safety needs immediately, but we're just kind of not sure because things keep changing. We're getting pretty regular updates from the governor and the mayor's office, and something that's concerning to me right now is there's still a lot of test results out there, I guess I should say, like that haven't been released yet or haven't been finished yet. So we're going to continue to be posting higher and higher numbers, which I think is not going to be good for the public view of things. But just to let y'all know, like that's coming while we're still behind in testing. They sent several hundred to Baton Rouge yesterday, and they already went through all of them. So we're kind of just trying to figure things out day by day. I wish I had a little bit more information for y'all, but things are happening so quickly right now. I do encourage y'all, if you have questions, to keep reaching out to me and some of the other reps. We kind of are becoming clearinghouses of information because there's just so much information out there that people are getting a little bit confused by it all. I would say if you can't reach someone, the NOLA Ready website, actually it's ready.nola.gov, is really, really good. They have information on where to get tested. They have information on unemployment benefits if you want to donate. If you hear of someone who they're trying to evict, that cannot happen for at least a month. And I've also heard the mayor is personally calling landlords who are trying to evict people. There's a lot of information out there on schools, on where people can pick up food, on where they can get information on how to, keep the kids activated. I think they're probably going to cancel all testing and potentially grades for the rest of the year, but that has to come through the Federal Department of Education. So stay tuned on that issue. I have also heard that there's been an influx, or there's about to be an influx of travel nurses down here. Not sure the amount on that. On the negative side, there's still a bunch of tests at Lambeth House that haven't come back. So things are really topsy-turvy right now is kind of all I can say. But I do feel like the governor and the mayor's office is keeping us updated and is trying to keep the public updated as much as possible. But if y'all have specific questions on certain legislation or just on anything that might be bothering you right now, I might be able to point you in the right direction for some of them.
Thank you, Mandy, so much. If folks do have questions, feel free to unmute yourself, or you can type them into the chat box if you're on the computer.
Yeah, there we go.
This is Julie. I think that you're right that March 31st, which by the way is Equal Pay Day, and we'll get to talking about that later, is probably unrealistic to bring people back together. It's about time. I was glad that they did finally decide to disband, because I think it was a bad precedent to not do it when they were telling all these other people to not gather. But I'm thrilled that the leadership did agree to do that, and y'all followed, which was good. If you do come back together late in May or June for what may end up being just urgent bills, one of the things I'm hoping will be considered is to include something like paid sick days as an urgent bill. The bill hadn't been introduced. You're probably more knowledgeable than I am about where Matt Willard is on and we're going to be talking to him in a day or two about a late introduction. But if it could become something that might be considered urgent, like some of the others, it might we might have a chance of passing something in this state. So we can talk about that later. I just wanted to bring that up as an idea.
Yeah, I mean, unemployment benefits, paid leave, my vote by mail has gotten huge new life. There's probably a solid 5 to 10 things that it would be great to get some attention on now to show that these are things that we really need and that we shouldn't have waited until such a serious emergency to pass those things. But paid leave and increased benefits are definitely up there.
Okay.
Yeah, Mandy, so I guess one of my questions, because, you know, the point of this is really to,
here people
to
are.
focus on what advocates can do. Are there, you know, what would you suggest? Should we be during this period calling our state reps and urging them to, you know, to prioritize and take action on these things that you mentioned? Are there things that we should be asking the governor to do? Later in the webinar, I actually have a list of things that other governors have done that you know, we can talk about in a little bit more detail. But what is your suggestion for those of us who, you know, want to be doing something to help move some things forward?
Right. I think that is helpful to look at what other states have been doing. And I've been like pushing that internally, like what Gretchen Whitmer has done, what Virginia's done, what Kentucky's done. Those things help. Just being honest with y'all, like inundating some of the people with emails, they're probably not going to get looked at right now just because we're just getting constant updates on like a million things. But I wouldn't say don't do it. I would just say that, you know, don't hope or expect a response immediately. But I do think that pointing out to the governor and to Republican leadership what's happening in other states in terms of response to the virus, but also emergency legislation could get some traction. And I've been working on some of my Republican colleagues individually. And I mean, one of the people who's pushing to double unemployment benefits is a Republican, because they're from a rural area and they see like this coming, like the devastation. So I think now is the time. Unfortunately, so many of us live in blue areas where our people are already going to be on board. Yeah. But this is such a state issue. We have so many rural areas of the state that I think highlighting how devastated they're going to be as well could kind of get us all on board together and focused on the emergency payments, unemployment, paid leave, and elections, I think are all top priorities.
Hi, Mandy. This is Megan, or excuse
Hey,
me,
Megan.
Representative Landry. Hey, thanks for being on the call today and for your time. This is like a comment / question, which I feel like, particularly at this time, all of the moving pieces have really revealed how like vigilant we need to be as far as who has what authority. And so I would ask like members on the call, and then just like us generally as we're talking about different pieces, like certainly there's the legislative piece, but will be suspended for a while. But generally speaking, like where do we urge the governor and the administration versus the legislature versus our localities and our cities? I think that that's something that I'm trying to keep in mind as far as who, you know, I know everybody's inundated, like who I'm bothering with what, because like what's really within their authority and control, and like where the pressure can be most effectively applied. So if you could just maybe briefly speak to that, or just like as we go along, just keep us abreast of what's the best information. Thank you.
Well, that's a big question. I feel like the easiest way I can kind of explain it is any large federal request or anything that's affecting the whole state obviously is going through the governor, with people like the mayor and localities as almost like administrators for a lot of those issues. Like, for example, the testing. I mean, the governor is the entity who's doing all he can to get enough tests from the federal government and make sure that we have ventilators and order ventilators, but the tests and the ventilators are being distributed through the localities under the direction of local government. It's in terms of, I mean, advocacy, I'm just, it's a little confusing what to tell y'all, because I know all these people are completely overloaded already with, you know, requests from even some of us. So it's hard to say like what you could do without potentially adding to the situation, unfortunately. Like today, for instance, I called a friend at Ochsner. I said, do y'all need blood? He's like, yes, please help us get blood. We need it. And so that's something I've been pushing out to the other reps and just on social media, just also like y'all to feel like I'm doing something, because they're getting so overloaded. And we got another update, like I said this morning, that we're about to just start getting more test results. And so the numbers are just going to rapidly increase and start to freak people out. It's just, this is such an unprecedented situation that we're trying to help them in any way we can, but not get in their way either.
Certainly. Yeah. And I guess I'm thinking maybe like what would be like for an executive order, like maybe being creative as far as maybe there's another mechanism to do something. And I'm just putting that out there as a general comment, but thank you for your response, for you know, being on the call and all of your work.
Yeah, sure. And the mayor and governor's declarations are all online. And the governors from, I think it was yesterday or the day before, like they lay it out pretty clearly. Like, for example, all court deadlines are stalled for at least a month. And so what that means is evictions are stalled for a month, and any trials or any court hearings or anyone worried about sheriff's sale or anything worrisome like that is stalled. On the other hand, I don't have a clear grasp yet on what's happening at criminal court. I know that Jason Williams and some others were trying to get nonviolent offenders who are being detained released, but I'm not sure if that's happened yet. So there's just like so many moving parts that, you know, the governor's declarations and the mayor's declarations can help with some of that, but there's so many things that can fall through the cracks as well. But they've been pretty good about updating the public on what's going on.
Needs to go on mute. That's not on mute. You've got music in the background. Please go on mute.
Okay.
Yeah, I'm going to go ahead and mute people. And if you do want to say something, then you can press *6 or hit the little microphone button if you're online. Okay, well, Mandy, thank you so much. We really appreciate you coming on and giving us some of this insight. And, you know, if you can stay on, we can talk a little bit in later on about some of the things that other governors are doing. I think one of the real challenges that that Governor Edwards faces is that there are a lot of things that I, you know, am hearing they want to do, but they are relying on the federal government to, you know, they need to get waivers. And so I think, you know, part of the challenge right now is the federal government should issue, you know, nationwide waivers for some of these things that are hampering states' ability to respond, like, you know, to expand access and to make, you know, sweeping sort of emergency changes to how they administer some of these government programs like SNAP and WIC and unemployment insurance. So, you know, there are layers of you know, different levels of government that can either impede or enhance our response here in Louisiana. So we do need to keep that in mind.
Oh, absolutely. I mean, I've been inundated with small business owners. I mean, New Orleans is full of any number or type of small businesses. And unfortunately, that's a multi-step process. You know, there has to be a disaster declaration, then you have to apply. Then it, you know, in normal times, it takes a couple weeks. This being an emergency, I don't know if that means it can be expedited or if it's going to take even longer since that's happening nationwide. I know that the governor submitted, for example, the small business request for Jefferson and Orleans, just because that's been moving a lot faster and is about to expand it to the rest of the state. But I mean, that's a perfect example. While we can help individuals with unemployment benefits, we can't actually help the businesses yet until the federal government gets involved. And we can't do anything with larger decisions on the school system until the Department of Education says anything. And I think also something else they're hoping for is, I don't know the details, someone on the call might, but like emergency SNAP, emergency food stamps, there has to be, there's, like you said, another layer with the federal government to get that out. So there's just a lot of moving parts, a lot of things we're waiting on that could expedite assistance to people. But I mean, our state is poor. We only have so much money. I know they're also trying to move 100 million somewhere in the state, like Michigan, I think did 125 into immediate assistance to people. But even that within our own state, and rightfully so, there are roadblocks to do that quickly, because we don't want it, you know, to be done too quickly without people paying attention where the money's coming to and from. But there are some roadblocks, and they are working on that as well. So I mean, you're right. There's just a lot going on, and fortunately or unfortunately, since this is happening here first, we're seeing all the stumbling blocks. But it might mean that we get some of that assistance earlier. I hope that's what it means.
Great. Well, thank you.
Sure. I'm going to go ahead and mute unless y'all send me something else in the chat room.
Okay, thanks. Okay, so we're going to move on to some of the other things, the priorities that we have here in the state. You know, kind of working on the assumption that at some point we are going to be working on these policies with the legislature in a non-emergency capacity. However, you know, we will be sort of talking about some of these economic security priorities, both in the context of, you know, making long-term policy changes and immediate emergency response changes. So the first thing that I kind of wanted to talk about is the Unleash Local campaign. So as we know, Louisianans overwhelmingly support higher wages, and they understand that we, you know, need to have different kinds of solutions to deal with the state's high poverty rates and other systemic issues. So a large coalition of workers, families, labor unions, community service organizations, and grassroots groups came together to form Unleash Local Coalition. And the goal is to repeal the state's ban on local authority over wage floors and like paid leave policies. So the campaign has been working both to establish a minimum wage rate that private employers would be required to pay, and also to establish a mandatory minimum number of vacation or sick leave days, whether paid or unpaid, and to be doing that at the local level and untying the hands of local authorities to be able to make those kinds of decisions in their own municipalities. I did include the website for people who want more information. The coalition held a call on Monday night and talked about, you know, the sort of existing larger policy priority of this campaign, and also talked a little bit about some of the, you know, emergency response efforts related to wages and paid leave. So that is, one of the campaigns that we, have been, we at Live Louisiana have been part of, and many other organizations that are represented on this call. So, we'll be following that and providing updates over the next couple months via these webinars and also email communication. But if anybody has any particular questions or insights that you want to share now, feel free to either unmute yourself or type something into the chat.
This is Julie. I understood what Representative Landry said about not inundating all of the local legislators who, for the most part, local being Orleans Parish, who for the most part are very supportive of an economic security agenda. And some of them are the authors of, or are the authors to be of, some of these bills. I do think that for those of us on the call, particularly those of you who have organizations behind you, letting your organizations know it is appropriate at this time to email and or leave a message for your state representative and your state senator at their offices, telling them that you're glad that they took the decision to stay home and stay safe and follow guidelines, and that you are eager to make sure they know certain policy things that you hope will be handled as part of whatever urgently needed bills do eventually get handled. And I think that some of these economic security bills could be considered to be part of the urgent needs of families to be resilient in times of crisis, whether they would solve this immediate crisis or not. And so raising the minimum wage and or unleashing local power to handle minimum wage and particularly sick leave days at the local level, these are urgently needed things, and there are arguments that can be a couple of talking points that can be shared to make sure everyone has that to communicate to their state rep that this is part of the urgency. And I do think also that people need to think about who they know that is outside of Orleans Parish and encourage them to be part of these conversations and networks, and to let their legislators know it is in Jefferson Parish, it is in St. Tammany, and anywhere else around the state that we're falling down on getting major support for these, other than through the Black Caucus and Orleans Parish. So those are my thoughts about what we could and should be doing at this time.
Thank you, Julie. So I'm going to move us on to some of the other proposals that were introduced that we, are going to be focusing on because it's what we've been focusing on for years at this point. As most of you know, because you are involved in the legislative agenda for women, equal pay has been a major policy priority for that coalition and many other organizations across the state. And so this year there have been several proposals that have been introduced. I'm going to let Julie talk about some of the details, but most of them are really focusing on expanding who is, who's covered by the Louisiana Equal Pay for Women Act, and focus also on ending pay secrecy, which is one of the biggest barriers to achieving equal pay. So Julie, do you want to talk a little bit more about the sort of regular legislative agenda on equal pay, and then also a little bit more about what you and Representative Willard have been talking about?
So on equal pay, which I think is going to end up falling by the wayside as one of the less compelling and urgently needed bills, but just so that everyone knows, the bill that we were most focused on is HB 447, State Representative Barbara Carpenter, who happens to be the chair of the Labor Committee. Not happens to be, she was appointed by the Speaker to be the chair of the Labor Committee. It's a stacked committee, stacked to oppose all kinds of good legislation, including some of this stuff we think is the most urgently needed. So HB 447 not only has the backing, or not just the backing, but she is promoting it, the chair of the committee. It has the backing of the governor. It's one of the 5 general bills not related to budget and stuff like that, that he put out in public that he was supporting around these economic issues. And so 447, which deals not just with pay secrecy and talking about no retaliation for talking about your wages, making sure people could at least discuss their wages voluntarily if they weren't the human resource officer blabbing about everybody's wages, but discuss it voluntarily in order to be able to find out if they have questions about whether they're being paid in a discriminatory or equal fashion, and being able to rectify it or move on. So it's pay secrecy, stopping pay secrecy, but it also has a provision for salary history. More states have been doing salary history because it's been harder to expand, even though there are already about 18 or 19 states that do prohibit retaliation. More states have been expanding protections from using salary history, which tends to perpetuate already discriminatory wages you might have gotten in the past, or low wages you might have gotten in the past. And there are all kinds of business reasons to support not using salary history. A lot of the larger, more progressive businesses are doing it. And so there will eventually be a one-pager on equal pay. The first bullet, the one about including, who's to include in who's covered, we had passed a bill in 2013 about covering, that ended up only covering state employees, not public city workers, not public parish workers, only state employees, because that's the way they amended it to make it less impactful. We have tried through various legislators every year, and this year Representative Green has a bill to expand what already exists as equal pay for women that does protect against retaliation in that bill, but it's only protecting right now state workers. We've been trying to expand that to all workers. That bill is not going anywhere. Probably the other bill won't either, but it doesn't even have the backing of the governor and the governor's team, because it's just, they wanted to focus on one bill. It's not like this is a bad bill. This is a good bill and we would love it. So just making sure you know it is not getting the most emphasis. And the third equal pay bill done by another friend, Kyle Green is a friend, and so is State Senator Joe Bowie, talks about trying to cover contractors working for the state. If we've already covered state workers with that Equal Pay for Women Act from 2013, we should expand to, and have tried to expand to, those private contractors working for the state. They're doing the state business. They should be covered by the same rules. And mainly the expansion of the rules we want are the ones that are in Barbara's bill, not being retaliated against for talking about your wages and salary history, anti-salary history provisions. That bill by Senator Joe Bowie, who's a big champion and friend of ours, is also not in the governor's package, though we would like it to happen. There is possibly a way that the governor could do that by executive order, although every time he's tried to do executive orders, he gets thwarted by Jeff Landry, who's being quiet now for his own reasons. We can talk about that later. So anyway, focus and equal pay on HB 447, Barbara Carpenter's bill, and you can always use verbiage to say we support all efforts to get equal pay for women and to stop, discrimination against women and all in pay, but our real emphasis is going to be on HB 447. Do you want me to wait and see if there are any questions on those before we talk about sick pay?
Sure. Does anyone have any questions for Julie? Okay.
So sick pay, State Representative Willard, who was at an event a few weeks ago when someone brought to my attention that we didn't have a paid sick leave bill in the hopper. There were other bills in the hopper dealing with minimum wage, et cetera, but nothing specifically trying to tackle the issue of paid sick leave. Louisiana has very poor numbers of people covered by sick leave, family leave, or medical leave. And I want to make sure everybody understands the difference between them. Sick leave has to do with just a day you earn time as a sick paid day. As you work, you earn time towards a bank of days that are waiting for you, so that if you do get sick, you can use up those sick paid days. It doesn't involve a whole structure like a workman's compensation structure where businesses pay into it. So that if you take long-term leave, that is not needed to just handle sick days. It just requires businesses of whatever size is in the law, requires businesses, and we hope eventually it will be all businesses, to allow people to earn sick days. Various states, there's I think 11 of them that have passed mandatory paid sick leave for various size businesses at various rates. We are trying to work with Representative Matt Willard, who still has the capacity and the desire to put in a bill before the 31st, which is the last day for new bills, to do that. We would like it to be considered an urgent bill related to the coronavirus and other types of urgencies that come up for needing paid sick days so that people don't spread illness. It's the people who are the least paid the least that are usually the ones that have the least, if any, sick days. And in Louisiana, we are, of course, higher than most states in the number of people who don't have paid sick days at all. 40% of our workers have 0 paid sick days. I think across the US, it's 25% have no sick days. So we're working with him to have a bill. We hope it will be considered an urgent bill, and we'll see. It ties into what you just heard about Unleash Local. So right now, only the state can change the number of required days for leave. Right now, there are no required days, but only the state can do that. We would like for the local government, and there's a really compelling argument for the local government to have that ability in New Orleans, which is the hotbed of, or whatever, the hotspot for the coronavirus identifications, at least at this point in time. Had the city council had that power, they may have been able to quickly say, everyone, you all have to provide sick leave of 5 days urgently. And then they could have maybe slowed down the spread of this because people having symptoms would not have had to choose between paying their rent and losing their house or apartment and going to work and, having to earn money even when you're sick. Luckily, the federal government is close. They're not there in doing something for the whole country, but we need this done at the state level. It should be urgent. And so we're going to support the Unleash Local bill that Representative Duplessis is putting in to give local governments the power to do it. And we're going to support the bill that Matt Willard is going to get drafted. And all this is subject to whatever happens with this urgent situation, shutting down the legislature, and none of us knowing what actually be allowed to be worked on as a bill towards the latter part of the time when the session would be in session.
Thank you, Julie. Does anyone have any questions for Julie on the emergency leave proposals? So I'm going to move us forward and talk about the ongoing efforts to increase the state minimum wage. So, as we've seen in past sessions, there have been several proposals that have been introduced. And, some of these are, related to, allowing local governments to raise the minimum wage. There is a constitutional amendment proposed that would give voters the opportunity to decide whether to, establish and provide a gradual increase in the minimum hourly wage, and then other proposals that would not be constitutional amendments, but would increase the wage in various ways and over various time periods. We have struggled, obviously, very significantly in past sessions to get a lot of support for for raising the minimum wage, but we're not going to be deterred. And we know that we have a significant number of legislators, particularly in the New Orleans delegation and in Shreveport delegation and in sort of the Baton Rouge area that are supportive of this effort. So I would imagine that, you know, when and if the session starts up again, that this, you know, will continue to be a topic of conversation and a priority for our legislators, because, or at least the, you know, progressive legislators, because I think, you know, another thing that this this outbreak is showing is, you know, how vulnerable people that are working minimum wage jobs are to any disruption in the economy or in their, you know, their ability to go to work. So I think that, you know, this is a time where we really need to consider having a living wage so that, you know, people have some, you know, have the kind of income that they can be able to save a little bit of money, or, you know, not missing one paycheck would, you know, is not going to send them spiraling into, you know, debt and to poverty that they are going to be really struggling to dig themselves out of. So, you know, we encourage everybody to, you know, to keep talking about how important minimum wage is when we're trying to address the overall economic security of people in Louisiana. I don't have much else to say on that at this moment, but if anybody else has questions or wants to chime in on this, feel free.
I'll just say that this is Julie, that the minimum wage bill that the governor is supporting is Troy Carter's SB 317. It raises the wage to $9 the first year and $10 the second year. It is not a constitutional amendment. It's a bill, as far as I know. Yeah, I think it's a bill. And so if any of them get traction, chances are that would be the one that will get traction. The Unleash Local Coalition has a separate Unleash Local bill about raising the minimum wage that we talked about, or allowing local jurisdictions to raise the minimum wage. And I'm not exactly sure who the author of that is going to be. It could be Newell, it could be Kyle Green, but anyway, there will be a second bill for Unleash Local, separate from the paid sick leave Unleash Local bill.
Great, thanks, Julie. That's helpful. Okay, so very briefly, I just also wanted to highlight a couple other bills that I think are important for, you know, for workers, and especially for pregnant and parenting workers in the state. So one is a proposal introduced by Stephanie Hilferty, a state representative, who has introduced a bill that would provide for family and parental leave for state employees. Now, this is different than the effort last year by the Family First Coalition to pass a family leave policy that would apply to, you know, that would basically create, you know, funds available for people that are working for private businesses. This would only impact state employees. And then Senator Regina Barrow has introduced a bill that strengthens existing pregnancy discrimination laws by making sure that the law applies to more employers. It would require employers to, if they wanted to, you know, say that providing these accommodations is a hardship, they would actually have to demonstrate the, that making accommodations for pregnancy is an actual economic hardship on the business. And then the bill also would inform employees that their employers have the power to accommodate their medical needs, so that, you know, workers would actually know that they could, you know, could ask for accommodations, and that their employer would need to you know, either make those accommodations or justify the reasons why not to. And we have, we've reached out to the National Partnership for Women and Families, who's done a lot of work on paid leave policies and on pregnancy accommodations policies. And they're working with us to get some talking points and some messaging together, and, you know, sort of like some analysis together on both of these, so that we can put together some one-pagers and resources for folks that we will hopefully be sharing in the coming weeks.
I want to mention that Barrow's bill is on the governor's list. Barrow's bill to, you know, expand those accommodations for pregnant employees, et cetera. Hilferty's bill is not. I am not absolutely sure, but I've heard that Hilferty's bill is actually an effort to consolidate what are various leave policies for state employees in different types of state entities. So there's the government, you know, the governor and the civil service, et cetera. They may have one policy, universities may have others, what other boards and commissions may have others, I'm not sure. I think what she's trying to do, and at some point, you know, and maybe Representative Landry knows, but I think she's trying to consolidate to give a floor that makes sense. As a woman who has had 2 babies while being a state representative, she understands about these paid leave policies and maybe trying to at least do that, which is great. What we need to do is understand the bill and I think support it. I'm pretty sure we can support it, but I do need to make sure I understand it better and use that to get to know Stephanie Hilferty and encourage her to expand what she wants for state employees and herself as a really good basic thing for the rest of the world, because the party she is in has constantly fought any kind of baseline requirements on leave, on parental leave. So I think it's good. I hope we can get confirmation that it is good and that and it's rational and doesn't sacrifice anybody who's already got better benefits than the one she's got in there. But that we also then use that, leverage that to get her to help us figure out ways to expand this to other people.
Julie and Michelle, this is Barbara. Julie, as you know, I'll be having a conference call with Stephanie Hilferty on Friday, one-on-one, and so I'm sure to bring up some of the suggestions that you made and get some answers to the questions that we have related to her paid family and parental leave, bill, and to see if it is a consolidation for state employees, et cetera, and I can report back to the group.
Thanks, Barbara. Any other questions about parenting student or worker accommodations? Okay. So I put this list together. It's not exhaustive, but I've been just sort of tracking what some of the governors are doing in other states and put together this this list of things that, you know, we're seeing, you know, governors in red states, blue states doing to try to address the, you know, the economic security that families are, you know, facing during this public health crisis. And so in particular, we've talked about expanding unemployment insurance and making it more accessible. One of the big issues with that is that unemployment insurance requires people to, you know, prove that they are looking for work. So part of what needs to be done is waiving the, you know, the requirements that people are actively searching for work. And I believe that that is a waiver that the state may need to get from the federal government. So this is one of these things that, you know, the federal government should just issue a nationwide waiver. Also, there's a wait time for unemployment insurance. And I don't know exactly what it is in Louisiana. If anyone does, please chime in. But it typically is between a week to 3 weeks in different states. And so waiving the wait time for people to be eligible for unemployment insurance is going to be really, really, really critical. So some governors, have expanded the eligibility for residents to access those benefits, through as late I've seen as April, as mid-April. So that's, one of the things that I think we know is a priority of the governor, and is something that, we should be working on. There is also like disaster unemployment assistance, but that's not available to states unless the federal government declares a national disaster. And so far that hasn't happened. We're in a national emergency, but not a national disaster. That program, which is actually much easier to access, is not currently available. At least that's my understanding. One of the other things that governors are doing, and we've seen action on this at the local level in New Orleans, is moratoriums on utility shutoffs and evictions. And so, issuing those kinds of policies statewide are going to be really critical. I think providing paid leave to, all public employees that are impacted is just as important. I don't know that, I think Mandy's not on the phone anymore, but even though the legislature adjourned, the staff are still being required to actually come into work. And, many of them should also be working from home as well, but the state, doesn't have that policy sort of set up to allow for that. And so that's something that I think that we could be urging the state to take action on. Other governors have extended the ability of pharmacies to dispense, emergency prescription refills for extended period of times. 30 days has been sort of the minimum, but I've seen up to 90 days in some circumstances. This also may be where, state action would run into federal, federal approval issues, because there are certain prescriptions that the FDA, doesn't allow for extended, prescriptions to be dispensed. But I think that that's, something that we could really kind of urge people to do. So that way, especially, people who are already dealing with medical issues, and older people who are accessing more prescriptions from pharmacies are having to make fewer trips to the pharmacy. And then the other thing that I think is really critically important right now is eliminating work requirements for TANF, which is the Temporary Assistance for Needy Families program, and SNAP, and increasing the benefit levels for SNAP households, which Mandy talked about a little bit beforehand. So those were some of the things that, I've been kind of keeping an eye on as they've been announced in other states. And I'm happy to open this up for, if other people have things that aren't on this list that we think might be helpful.
Michelle, this is Barbara again. I think one of the most important things, statements that you made, was that we have declared statewide a national emergency, or a statewide emergency. But if we were to have the governor declare a statewide disaster, can't remember exactly the language you used, but disaster versus emergency, that a lot of these things would be opened up. There would be more benefits for our people. And maybe this is some action that we need to take collectively to encourage the governor to do this. And the reason I say that we are probably in that disaster mode versus emergency is that you may or may not know, I was on a call with Together New Orleans yesterday, and that Louisiana has a 37% positive rate, that we're basically number 3 in cases per capita. They even said that New Orleans is kind of the Wuhan, I should say, of these spreads right now, and that it all emanates from Mardi Gras. That's why we have so much community spread right now, that we're kind of the fastest growing. So if we're going to do something, to avoid, what Italy experienced, I think that, to cut down on the severe outbreaks that are taking place, not just in New York, but New Orleans. They haven't really talked about what we're going through as much. We need to have the gap now.
Thanks, Barbara. So just to clarify, my understanding is that the national disaster would have to be called by the president and not the governor.
Okay.
Yeah.
Gotcha.
But
right.
yes, I think your points are well taken. All right. So I want to talk a little bit about the pending proposal in the federal government, which is the Families First Coronavirus Response Act. So this is what the House passed. It includes provisions that, sort of the first steps that we need to take, which is additional funding for SNAP program and for WIC, waivers to allow the states more flexibility in providing emergency food assistance, and then, supplemental funding for local food banks. So that's kind of the first part of the act. And then there are provisions that would make the testing for this virus free to all Americans, making sure that provider visits for testing are available and covered through Medicaid and the Children's Health Insurance Program. And then it just increasing funding for public health programs, including Medicaid and CHIP, by increasing the state's medical assistance percentage, so that the federal government would give the states more resources in those programs. And then the third part of this act is addressing the unemployment and leave benefits. So it seems like the sticking point is immediately providing fully paid sick leave for 14 days for people that work in companies with fewer than 500 employees, and then offering 2 weeks of 2/3 pay for people to care for family members. And so my understanding is that would include, the ability of people to take off work because their children's schools are closed and they don't have childcare options. The other provision is the ability to take up to 3 months of job protected family and medical leave, and then providing emergency grants to states to be able to meet the increased need for unemployment insurance benefits. So that bill was passed by overwhelming bipartisan support in the House, including being supported by, Steve Scalise and Garrett Graves and some of the other unlikely characters in Louisiana. But it's been stalled in the Senate. I think, as of this morning, the Senate still hasn't taken the bill up. Mitch McConnell has seemed to indicate that he is interested in taking it up. But I think this is a really critical time for us to be putting pressure on our senators to get this done now, and and then and then, you know, they can continue to work on some of these other ideas like writing everybody, you know, a check immediately, which I think also would be beneficial. So our call to action for this first Women on Wednesdays on Web is for folks to please call your US Senators, Bill Cassidy and John Kennedy, and urge them to, you know, to vote for the Family First Coronavirus Response Act. You know, because I think this is the, you know, a critical first step that the federal government can take. And then we will continue to keep folks abreast of other proposals and other pressure points that need to be taken in the federal government to allow us here in Louisiana to be more successful in how we're responding to the virus. Do folks have any questions about this or any of the other federal proposals? Okay. So we're going to conclude our first Women on Wednesdays on Web under the time that we allocated for it, so that's good. As I had mentioned at the beginning of the call, we are recording this, and I will send a link to the recording out to folks so that you can go back and listen to it. And we'll also be sending out more information about the specific bills that we talked about in the coming weeks. If you or your organization is working on something right now that you know, you want to highlight as part of this series, please reach out to me, Michelle Ehrenberg, at either the phone number or the email address listed below, and you know, we'll be happy to add you into to this agenda. And we also really, you know, urge people to share the information for how to join these webinars with your organizations and your networks and constituencies. We have a Facebook event page and an Eventbrite page that you can use to share information with people. We are reaching out to other lawmakers to try to line up some more speakers in the, you know, for the next one, which currently is scheduled for April 1st.
May I say just one thing? Thank you very much, Michelle, for doing this. It's really, I think it's really helpful. And the people on this call, many of them are leaders in other organizations or in networks that they can influence and spread the word. And that's why they've taken the time to be on this call. Sometimes it's very hard for leaders to even do what they're asking other people to do. And I had sent out an email a day or so ago, similar to what, you know, the action item is today, about the Senate. And of course, I do call my senators pretty much daily, but I also sent out information to people asking them to call their own state rep and their own state senator, not inundate them with a lot of demands, but just thank them for going home and doing what they should have done, and saying that you're going to stay in touch with them on some key issues that you think are urgent, and mentioning what those issues are. It is not overly burdensome to do that, and I suggest that you do that yourself as well as ask other people to do that. Contact your own state senator, your own state representative, and say something and establish that relationship if you don't already have it with them, so that they know you as a leader who's going to stay in touch with them in an appropriate and actually informative way now and in the future. I think that's really, really important to take step one.
Thanks, Julie. I couldn't agree more. And then I think one of the other things that, you know, I've been kind of considering, understanding that a lot of our lawmakers right now and public officials are feeling overwhelmed and vexed by this situation. I do think that there are things that we can do in the meantime, like getting people to sign petitions so that, you know, we're helping the, you know, get the opinions of constituents to their lawmakers without completely overwhelming their, you know, phone systems. So that's something that we're kind of considering. I'd be happy to touch base with folks and have a longer conversation about, you know, whether or not we think that would be valuable. But for the meantime, I do think, yes, it is important that we, you know, reach out to our, you know, state lawmakers and to our federal lawmakers and let them know what we think it's important for them to be doing right now, and what our policies, you know, our policy priorities are for, you know, making sure that we are creating more economic security for families in Louisiana in the long term, so that, you know, when we face crises like this, it's not, you know, economically so devastating for our families and our communities. So with that, I want to thank everyone who joined the call today, who asked questions, who provided information, and we will plan on talking to hopefully you and more people on April 1st.